So we're going to talk now about some factors that affect elimination or affect bowel elimination. First of all, developmental. Newborn stool, the very first stool is called meconium. It is this thick, black, tarry substance. It's very sticky, but it doesn't have much of a smell. And if you dilute it out with water, you'll notice that it's actually green. It's black because it's very concentrated bilirubin. So once they've passed the meconium and they're getting some food into the gut, then the type of stool really depends on what they're being fed. Breastfed babies' stool is yellow, curdy, and very soft. It looks a lot like maybe mustard mixed with cottage cheese. I'm going to ruin every food you ever loved, by the way. It looks like mustard mixed with cottage cheese. It has an odor, but it's not a super strong offensive odor usually. One thing to know about breastfed infants that unless there is some pathology, they are not constipated. In the first few weeks after birth, they may stool every time they feed. After a few weeks, some babies switch to a pattern that they'll not stool for several days and then go a lot all at once. And up to 7 days for a breastfed baby is considered normal. As long as the stool is soft and passes without pain or without apparent pain, then it's not constipation. Now, babies do have to they look like they're really straining to stool because they don't have any abdominal muscles. So they're building up those muscles. Formula stools are pasty, thicker consistency, green to brown. They're usually passed once or twice a day. It is possible for formula fed babies to get constipated. So we don't let them go 7 days, but they tend to have a little bit more regular pattern. If a baby is getting both breast milk and formula, really they can have either kind of anywhere in the middle in between those two types of stool. Toddlers usually toilet train around 2 to 3 years old. Preschool and school age kids, constipation is not an uncommon problem. Constipation can lead to encopresis, involuntary loss of stool. So anytime that a child who has previously been toilet trained begins to have stool accidents, constipation should always be the first thing to evaluate. It's the most common cause of stool accidents. It also is a pretty common cause of urinary incontinence. So what happens, they don't go to the bathroom. Maybe they're not getting enough fiber, fluid, exercise. Maybe they're don't want to take time out of their day to go to the bathroom because they're busy playing. And the stool gets hard over a few days. If they go for a few days without a stool, they have an impaction. That impaction, if they are able to pass that really hard stool, it hurts, so that tends to cause them to withhold even more. They can actually begin passing liquid or soft stool around the impaction and even have an impaction and still be passing completely solid stools. So even if they're stooling regularly, a child with encopresis, the first thing to always check out is, are they constipated and are they impacted? That tends to be a long-term treatment issue. When we get older adults, peristalsis slows down. We also tend to have decreased activity and decreased muscle tone. So those things increase the risk of constipation. And in elders, the sphincters tend to relax some. In pregnancy, we have slower peristalsis. The growing fetus takes up space and can kind of make it difficult for the stool to move through the gut. Constipation is common. Hemorrhoids are also common because of both the constipation and the pressure of the pregnancy on the rectal veins. Some other things that can affect bowel elimination, what we take in. we've all seen that patient that doesn't take in enough food, and then they're concerned that they're constipated because they're not taking in enough to actually stool adequately. Getting enough fiber, adults are recommended 25 to 30 grams of fiber per day. Getting adequate fluid for most adults, that's 2 to 3 liters per day. If they're constipated, they need more. And then food allergies and intolerances can cause diarrhea or constipation. Physical activity increases peristalsis. So people who are sedentary are more prone to constipation. Mental health, anxiety and emotional distress can increase peristalsis and cause diarrhea. Depression slows peristalsis. Social and personal habits. How willing is that person to use a public toilet? That may cause them to withhold through the day and lead to constipation. Frequently, we want to wait till a more convenient time. Again, our lifestyles are so busy that we're not taking time to even take care of basic physiologic needs. So that increases the risk of constipation. And there are people who also believe that they need to have a daily bowel movement. And so if that's not happening, they're taking action to try to treat that perceived constipation. Positioning. Squatting facilitates complete bowel elimination. There actually are devices now, little stools you can put under the toilet to facilitate a squatting position. It is also more difficult to defecate lying in a bed or in a bedpan. Pain with defecation tends to lead to suppression of that urge and withholding, which causes the stool to get drier and harder, which causes more pain. So it becomes a cycle. Pain in general can also decrease peristalsis, and any opiate pain meds decrease peristalsis. So patients who have chronic pain frequently also have chronic constipation. Surgery and anesthesia can affect bowel function. Immobility affects bowel function. Anesthetic agents and pain meds all can slow peristalsis. And any abdominal surgery, if we're handling the intestines, that can cause paralytic ileus. Rectal or anal surgeries may cause pain and anxiety about defecation. Medications, there are a lot of medications that have laxative effects, and there are medications, there are a lot of herbal remedies that have laxative effects. There also are medications that decrease peristalsis and can be constipating. Anything that's sedating, anticholinergic anticholinergic tends to decrease peristalsis and slow the gut down. Chronic laxative use, especially if people are using stimulant laxatives, actually will lead to dependence. So the bowel will not empty without those laxatives. The bowel becomes less sensitive to distension from feces. So those are some of the factors that affect bowel function. Next, we're going to talk about assessment of bowel function.